Hello, I am Dr. Pinkal Desai. I'm Associate Professor of Medicine at Weill Cornell Medical College, and my specialty is leukemia. Um, we are at ASH in 2023, and we are talking a lot about new drugs and how they have impacted AML therapy. We specifically talked about FLT3 inhibitors and their role in maintenance. So there's a couple new indications and new drugs that are going to be important in this space. In patients who are going through a stem cell transplant, there's data that came from the Morpho trial that if you do the right test and a deep enough test, and you find that you can detect this FLT3 mutation on that test right before stem cell transplant or immediately after stem cell transplant, these patients are the ones that benefit from giving gilteritinib as a maintenance strategy. And those people who are negative for that and we can't find them, and those are they don't need gilteritinib maintenance. That's important, but it's very, very necessary to do the right test for this indication, because this test was a very deep way, not the test that many of the labs do these days. The other maintenance strategy that's coming around is quizartinib. This was trial that was looking at patients who got quizartinib versus not after chemotherapy, and this trial was positive. So patients who basically get quizartinib during that initial therapy and then either go on to transplant or don't go to transplant, quizartinib should be given as a continuation therapy. So two new drugs in this space for maintenance approaches, and there'll be more to come as we analyze this data in the future.